I think there's no question that as we move forward, and again with the relative unknown of what's happening at the federal level in terms of what healthcare reform is going to look like, I think the fact, especially for our cancer patients, where they're in our clinics, they're seeing us, I think how this model evolves will be determined and will probably morph over the next couple of years, whether it's partnering with a medical oncologist, bringing them in as a partner, as a full partner versus a subcontractor. I think again, if we keep the concept that we're going to take better care of our patients, and that's always going to be the priority, we will develop models that hopefully will have that resultant effect. So
I think you just have to be a little careful, though, that when it's the old saying, if you go to a radiation oncologist, they're going to get radiate. You go to a urologist, you're going to get surgery. You go to a medical oncologist, they're going to vacillate. But I think we all get involved in this, even in academic centers. If we get some gimmick or some piece of equipment, we tend to drive people to that when in fact it may not be always the right thing to do. We're not giving them the balanced opinion of other things.
You know, in this country, roughly 2,000 urologists are in large urology group practices.
yes.
And in academics, Dave, how many academic urologists are there in the country?
Well, I don't know.
Or like 500? I mean, it's not a real large number. And if that's true, then that's 2,500 out of about nearly 9,000 urologists that are practicing in this type of a model. So I would say that today, probably there still is a huge role for the single practicing urologist or a small group, hospital-employed urologist or whatever, to integrate, some of the newer models and the new cancer treatments as well. So, we're a little bit biased toward the larger group and the subspecialization, and we all feel strongly that that's probably a better way of doing things, and it probably is. But reality is that there's still a whole lot of urologic oncology being delivered by one or two urology practices or employed urologists in this country.